Welcome to Blue Wave Medicine's lecture series. I'm Brad Jacobs, your host, and today we'll be talking about hyperbaric medicine with our guest, Jacqueline Chan, who's Medical Director for Hyperbaric Recovery of Marin. Hope you enjoy our conversation. So without further ado, we'll get started here. Thank you for coming, Jacqueline.
Thank you so much, Brad.
It's great to have you.
Thank you.
Yeah, and I thought we'd just have a really conversation, a bit of a fireside chat. I'd love to learn a bit about your story in general and learn a lot about hyperbaric oxygen. It's a lot of people talked about it for different things like COVID, for strokes. It's been, I know it's approved for Medicare, will pay for it for certain conditions. So I'd love to learn more about that. I know a lot of people have a lot of questions as well. Towards the back half of our hour, we'll leave room for questions. And we're fortunate to have Dr. Harris Maskett, my colleague at Blue Wave Medicine, here this evening. But let's get started. So maybe, Jacqueline, if you could give us a little background about your story overall, what brought you into medicine, what brought you then into interest in hyperbaric?
Sure, yeah. I grew up in a medical family. My father was a psychiatrist. My grandfather was an infectious disease doctor, and my mom was a nurse. And so that set me on kind of like lots of dinner conversations about health and healing. And I started off in family practice, but I felt like that only showed you one portion of the pie, which was drugs and surgery. And I felt that there was a much broader scope to healing and health that included some of the wisdom from the Chinese, some of the wisdom from the Ayurvedic, and other things such as movement and somatics and so I became the first group of physicians that was board certified in integrative holistic medicine. And I've been boarded twice through that organization. And so fast forward, I had a part-time practice at Advanced Hyperbaric Recovery of Marin, just very, part-time. And I became fascinated with the patients. And it was really the patients that I saw and the results that they were getting that made me very intrigued in this form of therapy, which I was taught very little about in medical school. I think we had it felt like an hour on hyperbaric oxygen, and it was for divers, for the bends, for decompression sickness. So that was part of actually my experience in Marin County, to be honest. I came from the Midwest and I came to Marin, and it was like a burst of, diverse, cutting edge medicine and healing modalities that I experienced here, and hyperbaric oxygen was one of them. So,
what can I say? I'm curious about,
sure.
Just to pause you for a moment. You had mentioned, so you had one family member that's a psychiatrist, right? Another one that was an infectious disease specialist.
Right.
So they couldn't be more different in their orientation.
Right.
One is, I think we were talking about earlier, one is sort of looking at the organism, that the sort of the pathogen.
Right.
And the other is looking at the human, their self.
Exactly.
And how well were they related somehow, siblings? Or?
My grandfather was the infectious disease doctor.
Yeah.
And
so how'd those conversations go was it your father and your grandfather?
Well, unfortunately, my grandfather passed when I was 7 years old, so I didn't. And he was from Hong Kong, and spent a lot of time in Singapore, and was the only one who could diagnose malaria during World War II in British North Borneo. So it was very interesting. So essentially, I grew up mostly with my father's influence, that most things have possibly an emotional or psychological basis. But integrative medicine really taught me that you really need both aspects, and especially the Academy of Environmental Medicine, where I really learned about toxins and how those interfere with binding sites for hormones and things of that nature. Yeah. So we get back to hyperbaric. What happened is I lived on Muir Woods, and I was hiking, and one of the gifts of Marin County, it seems, was getting a deer tick bite. And I I took antibiotics immediately for 3 weeks, and about 3 months later, I developed a Parkinsonian tremor, and that was really scary. And it was only in one hand, and I developed a facial tic, and I happened to be working beside one of the top experts in Lyme disease in the country, Dr. Wayne Anderson, naturopath. And I met all the criteria for Lyme disease, and he treated me. And I'd say within about 6 weeks, I was markedly better, mostly better. But my brain wasn't better. So my brain was downshifted. And I went and I did hyperbaric, and I did 40 hyperbaric sessions. And at the 35th session, the oxygen went to the area of my brain when I was 14 years old and I'd fallen off my bicycle. So at age 14, I had fallen off my bicycle on a bike tour in Ireland, and I was hospitalized for a week. I couldn't remember how to walk. I didn't know my name. And that back then they didn't do CAT scans or MRIs, definitely not in rural Ireland. And I'm pretty sure I had some pretty severe brain scarring. And the bugs had gone to that part of my brain where the scar was. And it was at the 35th session of hyperbaric, I had a complete flashback to the accident. I felt my knee, my eyebrow where I had stitches. I had an emotional response. I started crying. And after that, I could think about 20 times faster. Because what the hyperbaric does is it actually goes through the scar tissue, and after 40 sessions, it does something that there's nothing else therapeutically in the world that can do this, and that is it lays down new blood vessels, angiogenesis, and it's doubling the stem cells with every single session. So it was totally remarkable really remarkable. And I wrote a book about my journey and how I healed myself, and all those things that I felt like a lot of people, all those things that I wasn't really taught in medical school. I never learned, but I learned through integrative holistic medicine. So I wanted the complete picture of, from diet to hormone balancing to detoxification to the gut-brain axis and to finally mitochondrial resuscitation and tissue regeneration. And hyperbaric oxygen really is in that quadrant of healing.
Can we speak a little bit about the book? I mean,
Sure.
You brought it. I haven't had a chance to read it yet, but I know people that have read it, and they really speak really highly of it. So Regenerate Your Brain, a breakthrough plan to restore your brilliant mind. So I know there's sort of a multi-step process that you go through in here, sort of a pie chart of different facets. Right. Maybe spend a few minutes and educate the audience about that, your program that you did personally and sort of how you put it into
Absolutely. Phytonutrients and flavonoids in your food are incredibly healing. There's over 8,000 flavonoids, and they actually protect the DNA in our mitochondria. And so I kind of start with diet, which is, rainbow colors and variety, and also protein. So in people who are vegetarian, there's a 58% increased risk of depression and suicidal thoughts. So, if you are a vegetarian, certain things that you may need to supplement yourself with, or make sure you have enough protein and amino acids, because the brain needs protein and amino acids, and it also needs fat. Our brain is actually 60% fat.
Sure.
And that type of fat, essential fatty acids, is not made in your body. The only way you get that fat is by eating it. And DHA is 80% of the fat that's in the brain, 80 to 90%, and it comes from cold water fish or walnuts. So if you eat, 6 servings of cold water fish a week, that's great, but a lot of people don't, and unfortunately, you have to even be careful of fish and your source of fish nowadays. If there's chemicals in farmed fish, or if there's mercury and other metals and toxins in the larger fish. So I'm a big proponent of fish oil as a number one, I would say, anti-inflammatory for the brain. And also there's been numerous studies showing that it lowers attention deficit disorder, anxiety, depression.
So you've got one part's the nutritional piece for the brain, and then probably movement and exercise.
Exactly.
Hyperbaric, I think, is also in that as well.
Yeah, some hyperbarics really, I talk about the mitochondria. So, I mean, just, some of the audience may know what the mitochondria are, but for those of you who don't know. Yeah, so the mitochondria are little organelles in every cell of our body. We have 500 of them per cell, roughly, and we've got about 2,000 of them in the nervous system. And they basically make ATP, which is our energy packets. Think of it as the electricity that runs your house. So when you don't have ATP, you don't have life. You need ATP for every single reaction in your body, from blinking your eyes to digesting your food, to contracting a muscle, to creating a thought. There are many things that will cause your mitochondria to weaken. COVID, or viruses, Epstein-Barr virus, SARS-CoV-2 virus, the COVID flu virus. So viruses can cause your mitochondria to weaken. Other infections, such as what I suffered, the Lyme disease, and then toxins. Toxins can interfere with mitochondria. And then there's something that none of us can actually get out of, which is aging. So, unfortunately, we lose a large section of our mitochondria as we age, especially over the age of 50. And there are certain things that you can do to help slow down that process. But generally, the symptom of not having enough mitochondria is fatigue. That's the main symptom, fatigue. Some people can be classified as chronic fatigue syndrome, or fibromyalgia, or post-viral fatigue. The fatigue can be more physical, like not being able to exercise, or it may be more cognitive. Like I get fatigued after thinking a certain number of hours, or after reading, after engaging, I have fatigue. And hyperbaric oxygen really resuscitates the mitochondria. So it goes in, it helps heal the cell membrane on the outside, as well as the mitochondria, and it really helps regenerate. And then it actually will create doubling of the stem cells with every single session. And then those stem cells are going to go around and create more energy.
So can we talk about that? So the hyperbaric oxygen and its effect on stem cells. Is there research behind that? Tell me a little bit about that.
So you could actually classify hyperbaric oxygen as a gene therapy. It's normally not thought of as gene therapy, but I'll kind of backtrack a little bit. The very first forms of life on planet was in the deep sea. So what do we have in the deep sea? We have pressure. And it was the cyanobacteria that built oxygen in the ocean for over 1 billion years. And then it went into the air. And after 1 billion years of it building up in the oxygen and going into the air, we started having other life forms. But the very first life forms were in the deep sea. And there's something about the pressure itself that actually shifts genetic expression. Up to 8,000 different genes are upregulated or downregulated through pressure and hyperoxygenation.
So there's some research have they done research where they take stem cells and put it in a hyperbaric environment?
Yeah, the research study. Yeah, the author.
Curious. Dr. Harris and I are doing PRP and stem cell injections we're looking at, and we've had a lot of people do stem cells. So be interesting is it, in theory, a non-invasive way to augment stem cells. So I'm of course we do it injections local, but I'm curious about the science behind hyperbaric and stem cells.
Yeah,
really interesting.
It's the 34 count, and the author was Fife. And I can get you the exact citation of the journal. But basically, the stem cells that are supported are coming from your own bone marrow. Yeah, that's where they're coming from. Because I know with stem cells, you can get them from the fat, or you can get them from different locations.
Yeah,
they do.
Bone marrow, but
this is from your bone marrow. And so what happens is those stem cells are alive for another 3 months after you stop hyperbaric, and they will continue to upgrade the body. For some patients, when the stem cells are circulating, they will actually feel a little bit more tired rather than energized because the stem cells are going to that area and they're working on things. So people sometimes will have a history of back pain and back surgery. They're not coming to us for back pain. They may be coming for a different reason, but then their back will kind of feel a little achy and then it's getting better. So it's because the stem cells are circulating in that area. Because with hyperbaric, you can have an increase in your chondrocytes, which is the cartilage tissue in the bones. It helps with bone healing. We had a race car driver who flipped his car and broke his spine in 22 different places, and he came in for hyperbaric. So it helps the bone, it helps the cartilage, it can help the heart, it can help the nervous system, the brain. Yeah.
So back to ATP, mitochondria generation, so hyperbaric. You get in there, and the thought is that it sort of up-regulates the mitochondria, or maybe leads to apoptosis. I don't know. Does it lead to apoptosis of certain mitochondria, or does it just up-regulate existing mitochondria?
It upregulates existing mitochondria, and it's also going to help clear debris because it's increasing the circulation of oxygenation 20-fold. So if we all took a deep breath in and then exhaled, and we held our breath out, we wouldn't be able to hold our breath out for very long. And that's because you can go weeks without food and days without water, but only 4 minutes without oxygen. So we need oxygen really more than we need food or water, more than we need anything else. And the air that we're breathing right now is 20% oxygen, okay? And we're at sea level. We can see the sea from this beautiful place at Cavallo Point. So that's 1 atmosphere of pressure. That's what we're breathing right now.
Yeah.
And that translates to 760 millimeters of mercury. That's what 1 atmosphere of pressure translates to. What else is in the air? We have about 79% nitrogen and 1% argon or other pollutants. And that can change with pollution. Like when we had the fires, the oxygen levels probably went down to about 16% instead of 20%, in the air. What you're getting in hyperbaric is you're getting 100% medical grade oxygen under pressure. And the pressures vary. So we actually have 30 different prescriptions for hyperbaric oxygen. It's not one size fits all. We go anywhere from 60 minutes to 90 minutes. And then the pressures can vary from 1.5 atmospheres of pressure to all the way to 2.8 atmospheres of pressure. Yeah. So if we use just a little bit of math just to understand, because we understand from medicine, we usually understand a substance that you take in. Could be a medication, could be something like vitamin D or a nutraceutical or a botanical, but we usually understand it as something that you take in your body. We don't normally think about gas, and how does gas translate into your body. So Dalton's law of partial pressure really helps explain your oxygen level in your tissue based on what the oxygenation is in the air and the pressure that it's under. And so for what you and I are breathing right now, 20% oxygen under 1 atmosphere of pressure, we have a tissue level of about 104, and that's what's in this slide on the left here. But with 2 atmospheres of pressure, which you would get in a hospital-grade hyperbaric chamber, 100% oxygen, that number goes up to 1,488. So essentially, you're getting 14 to 20 times as much oxygen in your system.
So I'd love to hear your view on, you're a little biased, I know, because you help run this facility, but there's those soft chambers.
Yeah.
They're $20,000 to $30,000. You can buy. Some of my patients and other people I know are interested in buying those because they would use them regularly, or they put them in a gym, and they seem to be proliferating a little bit more. They go to sort of 1.4, I think, is the max, without having to become a medical grade device. My understanding is correct. But they can use it regularly. Like you can go daily, and so. Do you have a sense for the difference between the two? And
yeah,
let's speak to that. I'd love to hear.
It's really you have to understand what the research has been done on and what the research shows.
Yeah.
So most of the research has been done on hospital grade chambers at 100% oxygen, 1.5 atmospheres of pressure or above.
Yeah. So for those that don't know, so that's a hard chamber typically.
A hard chamber.
Yeah.
And
And it requires, it's way more, well, do you want to speak to sort of the risks
Sure.
around it and medical grade?
we have to meet a lot of fire code. It has to be built a certain way. We have certified hyperbaric technicians who are trained like paramedics. It's a 1-year-long training. We're handling, these huge dewars of oxygen. It's the danger with oxygen is explosion and fire. That's a danger. So we are under tremendous amount of safety precautions.
Yeah. So you have to remove all jewelry before getting in the chamber, and right, it's all only clothes.
Exactly.
And so that's at this high atmospheric pressure. And I know most of the research has been done in that capacity. It's sort of like, in my mind at least, and it's a question really, which is, so if I have this very intense option, or that I do once a week, or maybe I do it for 40 sessions 5 days a week, and I'm done, but I could get my hands on a chamber and at a gym and do it every day for the year.
Well, it kind of depends on what your goal is.
Yeah.
Okay, so we should talk about I mentioned the 12 conditions that hyperbaric is absolutely proven and covered by insurance to cover.
Yeah, we have a slide.
Yeah,
want to read
and
it.
Hyperbaric is covered by insurance and proven to be effective and life-saving, really, in air gas embolism, which is in carbon monoxide poisoning. So those are in cyanide poisoning. Those are all of these are very, severe conditions. Crush injury, the bends or decompression sickness, enhancing of select problem wounds. We do have some patients who come in electively after plastic surgery, and they want to get the healing faster. They want to get the swelling down, and sometimes just 2 weeks can make a really big difference. Yeah. And then we have some that are severe wounds. They're failing antibiotic therapy. And then we have some that say flap or graft from a plastic surgeon that's failing. Exceptional blood loss anemia, anaerobic infections. It will completely treat gas gangrene, necrotizing soft tissue infections. But the two things we see the most actually are the next two, osteomyelitis and radiation necrosis. And where we see that is in men who have prostate cancer and get radiation. So there is something that happens for men who have received radiation for prostate cancer where they can get radiation cystitis, which is their bladder starts becoming irritated and they can pee blood. Doesn't happen to everybody, but hyperbaric is like 85% successful in that. We'll completely get rid of it. And same thing with anyone who had head and neck cancer and had radiation to their head and neck area. They can have a breakdown in their teeth later on, 5 years later, and hyperbaric is excellent for that. Yeah. It's also excellent for any kind of radiation burn on the skin from breast cancer, and it's all covered by insurance for that.
Yeah. What I find interesting about these is a lot of the ones that are covered by insurance, either are lung or skin, which from a Chinese medicine perspective are the same thing. But what's interesting to me is like, okay, that can make sense. I'm breathing in this high grade oxygen under pressure. And so I can see how it would heal that. But then when you go into osteomyelitis as an example, or the cystitis is another example, where it's not immediately on contact with oxygen. So that leads to sort of where we're leading to next, which is what you're talking about, which is when you're breathing it in, you're getting this oxygen, enhanced oxygen into the bloodstream, and then it's going to affected areas. And I know we'll talk about stroke and brain injuries as well, which are not exposed to the oxygen, right? So I think that's worth noting and a really important facet to those that are skeptics, because there's a lot of people that are quite skeptical about hyperbaric oxygen.
This is the thing, the other superpower of oxygen, because sometimes we call it Superman without cape, the chambers. So when you have your blood is circulated, usually we think of the major vessels, like the carotid arteries and the femoral arteries. But we have actually 17,000 miles of capillaries and venules. And our oxygenation, that's where our oxygenation takes place. So it takes place when the blood goes down into that little capillary and it's single file. When the blood cell is now single file, and that's when it offloads its oxygen and becomes venous blood or blue blood and goes back in through the venous system. So that's the circulation system. Well, when you have 20 times as much oxygen carried by that red blood cell, what it does is it comes off the red blood cell and it goes through the capillary wall and it goes into the tissue where there's no blood. So it goes beyond the blood cell. So it goes into the bone, it goes into scar tissue where there's no blood vessels able to reach. And that goes into the joints, it goes into cerebral spinal fluid. That's the magic of hyperbaric oxygen.
So what are the most common conditions that you see? You're in Marin, and in Marin's location, a lot of people can afford to pay out of pocket probably as well. So I'm sure you get a lot of folks that meet this for criteria that CMS, Medicare will pay for. What are the ones that Medicare doesn't pay for that you see?
Yeah, I mean, oxygen is incredible for the brain and the nervous system. So we see a lot of people with chronic fatigue syndrome, post-viral or post-infectious fatigue, whether that's long COVID or Epstein-Barr virus or Lyme disease. We also see people after a stroke. It's incredible after a stroke, and traumatic brain injury. So after a bad fall.
I think we have a slide about that somewhere in here. But maybe talk a little bit about concussion. You had a concussion way back when, and then when you had Lyme, that sort of reignited that memory, came forward.
Yes.
But I know kids that play sports and have had significant concussions that have been treated up at your facility, and maybe you can speak to
Sure. I have a patient I'd love to talk about. She actually has a video testimonial on her website. But she was 28 years old. She was a nurse in the hospital in the ICU, and she loved her job. And she got in a car accident with her husband, and she just had a whiplash. That's it. Her husband was fine, but she was not fine. She ended up having a lot of light and sound sensitivity, really actually couldn't function at all. She couldn't take care of her 4-year-old. She couldn't go to work. And the doctor said, just lay in a dark room. And 9 months later, she's still laying in a dark room. There's something off with that. They finally did an MRI, and they found out that she'd actually had a cerebellar stroke. So she had actually, in the whiplash accident, the membranes, because she had meningitis when she was 4 years old, so she had scarring of the membranes. They actually sliced through the blood vessels in her brain, and she had a bleeding brain, which no one had really picked up initially. So 9 months in a dark room was unacceptable for the rest of her life, and not being able to mother or work. After 5 sessions with us, she had this her eyelid would droop, and she had horrific headaches. That was the first thing that went away. Her eyelid drooping went away, and her headaches went away. By the end of a full set of 40 sessions, she was back to work full time. And she actually had called her sister to fly over from New Jersey for her daughter's 5th birthday. And because she said, I can't handle it. I can't handle being around children running around. And by the end of Hyperbaric, she was going to amusement parks and able to celebrate her daughter's birthday and everything. So she was thrilled.
So with this is a stroke, but let's say for concussions, maybe. So do we have a sense? Is there research going on around it now? I know there's large concussion centers, that have formed in academic affiliated institutions. I know University of Maryland's got one, and others. So curious about the role of hyperbaric and what's been looked at.
There's been many studies on concussions and hyperbaric. So what happens is when you have a concussion, you're falling and you're hitting your head somewhere, right? And there's a bruise on the brain tissue. And what happens is there can be an area that gets stunned. And whenever there's less oxygenation, there is the microglia, which is the part of the immune system of the brain, become hyperactivated.
Yeah.
And it's different from other parts of our body. So the immune system of the brain is different from the immune system of the rest of our body. It's more sensitive. And they've actually done studies where about 30% of people who have a concussion can have what's called Postconcussion Syndrome, which means that 6 months after the concussion, you may have symptoms of dysautonomia, which is like maybe your sense of balance, blood pressure, heart rate is off. You can have dizziness. You can have brain fog. Your hormones can be lower. And mood issues, major mood issues, anxiety, depression, attention deficit disorder is huge. So that inflammation can actually last for at least 15 years, believe it or not. Now, in my case, it was treating a concussion that I had at the age of 14. And at the time I got hyperbaric, I was in my 40s. And it went all the way back to that area and healed that area, which was incredible. So, so am I answering your question?
Yeah, I was just curious, I'm interested in the research that might be forthcoming or looking at this, where they, might randomize folks that get.
We can, the NFL, the NFL approached us and, they definitely were aware of the benefits of hyperbaric oxygen post-concussion. So we'll see. It'd be interesting to see what kind of research is forthcoming. So, and then I know for strokes as well. So, I know people have used it for strokes. Maybe you can talk a little bit about that. Yeah, sure. So when you have a stroke, there's an area of the brain that, it gets blocked in oxygenation. And there's that area around it is called the penumbra. And so think of when you turn your car you don't turn it off, but you're parked and you're idling. That's kind of what happens to the brain. So the cells don't actually stop. They're not dead. They're just like Sleeping Beauty. They're just idling, and oxygen will wake them up. And so I had a patient, he was 6 months post-stroke, and he lost his speech. And it was devastating for him. He'd been an engineer. Yes, he was in his 70s, but, it's devastating for anybody to lose their ability to speak. And after 40 hyperbaric sessions, he was, I'd say, 70% better. I said, let's go another 10, because some studies show going up to even 50 and 60 sessions, and he was fully recovered. In fact, we did MoCA tests. You may have heard of the MoCA test. That's a test done for dementia. And you have to remember the name of a camel, the name of a lion. You have to be able to spell world forwards and backwards. So it's a test for dementia. And he checked his score was so low. He was in the dementia category. And after the hyperbaric, he was a completely normal MoCA score. He actually was crying. He was so happy about it. So we've also treated a girl who's in a coma for a month after a car accident. She could only move her arm about like this and her leg. And she also got 90% of her function back with hyperbaric.
Wow. So tell me about, you have this graph here or this table about the stroke research. I'm curious, some of this stuff from the 80s, but I'm curious sort of what your take is.
Yeah. This is essentially, what we're seeing is, I think a lot of people, unfortunately, most neurologists don't know about hyperbaric for stroke, and it's also not covered by insurance. But it's such an incredible game changer for people. In this study, it mentions 122 stroke patients in acute and chronic stages. And of the 79 patients treated with hyperbaric, 65% reported improvement in their quality of life. It also helps.
They got discharged early, right? They had a shorter hospitalization.
Yes.
Yeah. Is there a risk for people that have stroke for bleed? So talk about that with hyperoxygenation. Is there a risk that since the cells are more friable in the setting of ischemia or infarct, is there a risk for bleed?
No, that's where the medicine of hyperbaric, they've looked at all those pressure and pressure gradients. And so the pressures that are used are safe for the body.
Yeah. You did, I remember I suggested one patient, whether he'd be a candidate, who had COPD. His was pretty mild, but I think you mentioned emphysema as a contraindication, right?
Yeah.
Is that right?
Yeah.
So let's talk about that.
Sure.
So people
out
there that may have pulmonary issues that may want to benefit from. In this particular situation, he had chronic pseudomonas. He had history of eosinophilia as well, pneumonia. And the thinking was the chronic pseudomonas, that colonization that perhaps with hyperbaric he might improve. And then we start talking about emphysema and COPD. So maybe
sure. So the lungs have to be able to handle pressure. So our lungs normally can, they expand and they contract. Well, with hyperbaric oxygen, you're breathing in oxygen under pressure, and so the lungs need to be able to expand. So bullous emphysema or severe scarring of the lungs is one absolute contraindication to getting hyperbaric because the lungs can't expand with the oxygenation, and you're at risk of having a little tear in the lung and getting an embolism. So that's the biggest risk. So it's an absolute, so that's an absolute contraindication.
What about if they don't have belly? If they just have emphysema or they have
essentially lung scarring is the biggest thing.
So the scarring creates friability,
right?
Under pressure, right?
Exactly, right.
Any other contraindications people should know about?
Chemotherapy. Some chemotherapeutic agents block the uptake of oxygen, so it's not going to really hyperbaric is not going to work and with certain agents, but we do have people with cancer who are getting chemotherapy who come to us. And it can be timed in such a way, in between their chemotherapy administration. So I want to talk a little bit about the anti-aging, if that's okay.
Great.
Yeah. Okay. Yeah, so there's been Dr. Shai Afradi had a very kind of milestone study showing that there was telomere lengthening of up to 20% in people getting hyperbaric oxygen. And so telomeres are an aspect of our chromosome that the longer the telomere is, and the higher number of years you're going to live. And so what they did in this study is they put a group of people through 60 hyperbaric sessions, but they did what's called air breaks. So they had these breaks of 5 minutes every 20 minutes. What that means is that they got room air instead of 100% oxygen for 5 minutes. So they're basically creating a relative hypoxia to hyperoxia situation, which was stressing the system in a way that lengthened the telomeres.
So it's a different protocol.
Yeah, it's a different protocol.
And versus you think 60 minutes alone wouldn't have done it, or it's interesting they chose that.
Yeah, that's really what was studied is it was this going from relative hypoxia to hyperoxia. This
was
break.
There to
100% oxygen.
back to normal now.
Exactly, right. And so it's a different protocol.
Yeah.
Different protocol that they.
So telomeres, as Dr. Chan was saying, so it's at the end of your chromosomes. With every division of the cell, it's like the end of your sort of shoelace tip, it'll shorten until the cell is so short that then the cell, upon division, actually dies. So it's a marker because, of course, as the cell ages, it's at risk for mutation. So we are programmed at the cellular level to commit suicide when we're at risk for too much mutation. And so the longer your telomere, the end of the tips there, it's associated with youth, if you will, and the shorter aging of the cell. There's mixed data about it, whether it's really how accurate it is, and I found very interesting over trending. And then to your point, if they do like lifestyle change, they can show like more meditation, for example. They can show lengthening of the telomere. So here's another example using hyperbaric, which is really
Yeah, I mean, I think there's many other things you can do in the anti-aging section in general. Hyperbaric's pretty, it's very time intensive, but the research is there.
No, I think I
Yeah.
think it's great. What other, what's your favorite thing to treat? Maybe we should ask you about that. And what are people most excited about when they come in and when they want treatment?
There are certain things. I'm a big fan of bioidentical hormones, actually. And I love getting a hardworking woman who's in her 50s or above. I mean, some of them are just like, you've changed my life, in a couple of weeks by putting me on bioidentical hormones. I love that because it just works. I love I think of the balance of our yin and yang energy. So many people I'm seeing are burning the candles at both ends, or maybe not even intentionally. It's just taking care of somebody, a parent, who has dementia or external circumstances. Certainly what we just went through, the pandemic, has caused, a tremendous amount of stress for some people. And I think that integrative medicine and functional medicine really shines in that area because we can help optimize physiology. So it's not necessarily about treating a disease. They may not have a disease per se, and all their labs may be normal, but they're the organs in their system that generally help keep them strong and healthy, such as their adrenals, kidneys, liver, can definitely be supported with botanical medicines. And, I'm a big fan of botanicals. Some of these botanicals were what Indians would take, they'd be chewing on bark when they were going on a 1-month hunt, and they didn't know when they were going to sleep, and they didn't know when they were going to eat or drink or what the circumstances were going to be like. And they rested on the strength of these botanicals to get them through. And so I like helping people gain, I would say, optimal physiology under extreme circumstances, but then help them in such a way that they're able to understand how they expend their energy and how they refuel, because we need to refuel in order to expend. And I love that conversation as well.
And then how about with hyperbaric? So people that come to the facility, what are the sorts of conditions that you get most satisfaction with?
Yeah. I mean, I've had a lot of satisfaction with the long COVID patients. We had a long COVID patient who couldn't work for a year. She was 36 years old. She couldn't exercise at all. She was a high-tech person, worked in the city, lived in Tiburon. And after 20 hyperbarics, her energy went from 1 out of 10 to 9 out of 10. It was tremendous. And there wasn't really a lot that mattered. There weren't really medications that could help her that much. She was on some, mast cell activation syndrome, H1, H2 blockers. She was on low-dose naltrexone. She was on zinc. She was on vitamin D. She was on probiotics. She was on a lot of good things, but she couldn't completely recuperate. And so it was really wonderful to give her all of her life back. That's
great. Yeah, long COVID's a tough one. It's unclear exactly what therapies are best, and we try to do a lot of different things. So I think there's a huge opportunity there. I'm interested in that one. I'm curious about, I must feel like an orthopedic surgeon feels gratified when they fix a fracture. I would think like someone coming in with, osteomyelitis or wounds, and you watch them heal before your eyes must be really gratifying.
Yeah, we've had some people we've been able to save their limbs. So we've been able to save them from amputation of their foot or their toe, from diabetic ulcers. We have been able to, we've been able to give people their lives back. And severe infection. I had one patient, she was an attorney, and she had what was called a neo-bladder. So she had her bladder removed because of cancer in her bladder, and she had like a bladder made out of sheep intestinal lining, and it kept getting infected, and she'd go to the emergency room like 18 times a year. And after hyperbaric, it was completely healed. She didn't have any more infections, and she could actually plan her daughter's wedding and help her husband out at the law firm and even start practicing law herself. It was amazing. Wow. So,
and then
and multiple sclerosis. We've had a couple multiple sclerosis cases that were completely healed. Wow. That was very rewarding.
Well,
yeah.
Tell me a little bit about sports injuries.
Yeah.
Slide here on that. Maybe we can talk a little bit about what your experience is. Who do you see typically in fractures? Clearly, so for bone healing.
Yes.
But any experience around tendon and
absolutely, yeah. Usually when we see athletes, they're professional athletes, and oftentimes we see them after they've had like injections, PRP, or after they've had surgery, and it's just really incredible for surgical recovery. It can really help the recovery process be extremely fast and thorough. So we recently had a professional Olympic downhill skier, and she fractured her ankle bone. And so we're helping her right now get her full healing back, because everything else she was doing wasn't working. It had been 6 months and it wasn't healing. So oxygen is going to really help the bones heal and especially if that's her, that's her entire career. She wants to get back,
Yeah. And do you ever use sort of the electrical stimulation on your own practice? Let's say a fracture, so they can do. There's a lot of research looking at the electrical stimulation across the fracture. Healing.
With the hyperbaric, with the patients that I see, I tend to stay in the lane of hyperbaric, because they usually already have kind of a team of doctors that they're working with.
Yeah.
So I just stay in the hyperbaric lane.
Now, I know you also have a private practice.
Yeah.
Yeah. So maybe speaking to that, do you ever get to sort of cross-refer?
I do. Yeah, I do.
Yeah.
So I actually work at 2 different places. I work at Advanced Hyperbaric Recovery Marin as a medical director, but then I also work at Marin Natural Medicine Clinic, which is a naturopathic medicine doing functional medicine, integrative medicine. And so, there is definitely a cross-referral back and forth. But certainly most of my patients aren't hyperbaric oxygen patients. Most of them are more in the wellness, optimal physiology or fatigue, area.
Yeah.
So
great. Well, we have a few minutes left. Maybe we can see if there's questions. Do we have a few questions up there? Let's tee up.
I've got a question from the chat in the Zoom. And if other people in the room have a question brewing, just let me know and I will hand the mic over. So the question, I'll just read it. It says, I have osteomyelitis in my upper jaw, knocked out a tooth at age 10, root canal in my 20s, went bad in my 30s, then 2 bone grafts and 1 gum graft with titanium dental implant. This spring, a short prophylactic antibiotic made it flare. Headaches, eye problems, inflammation, and irritation. A cone beam CT scan shows a hole. What do I need for insurance to cover this therapy? A prescription?
He needs a bone biopsy showing that there's infection. And we have 2 staff members who work with insurance companies around the nation and with hyperbaric oxygen facilities around the nation that can help. They kind of get their group insurance ID number, and they can basically predetermine if it's going to be covered by insurance or not. But generally, they need a actual biopsy of the bone tissue with a path report showing infection. And it's usually got to have failed 6 weeks of IV antibiotics. Yeah.
Jacqueline?
Huh?
So I have no idea what one looks like, so I don't know if you have a photo.
Oh.
And But related to that is why 100? Not 100. Why 40? Why 40 sessions? What is?
Sure. Gosh. Okay. So, confession about the slides. There were a lot of them. We've combed them down. But there was one in there showing what the hyperbaric oxygen chamber looked like. We have what are called monoplace chambers, which is one person per chamber. Kind of looks like a small submarine with little round windows. But then we also have ones that look like all glass. And we have a TV monitor on the outside. And it's actually a very, very pleasant experience because you're breathing in 100% oxygen. Really, the only part of your body that you feel the pressure is your ears, just like if you were scuba diving or in an airplane. You just need to be able to clear your ears, and you can watch a movie. We have a great library of movies. You can plug your phone in, listen to a podcast, or you can play music or a meditation or just sleep. That's in other places, mostly in hospitals, they have multi-place chambers. So that's a larger room where you may sit down with 15 other people and you're given a mask and they pressurize the mask. Or they put the 100% oxygen in the mask, they pressurize the room. But you don't have the movie going and you're in a room with other people. But that's, most hospitals use that kind. And some other larger facilities use that kind.
They typically are 36 to 42 inches in diameter.
Okay, yeah.
And then a lot of them have the glass so you can see out.
Yeah.
Some people still feel claustrophobic, but they try and optimize the good ones, try and optimize so that you don't feel that way.
Right.
Yeah. And then it's in a pretty large room, generally speaking, as well. So, but it is a bit of an ordeal, like to get in it, and then you got to, and then once you're in, you're settled, and they have the screens, and it's comfortable.
We do have a gurney, so we can even take people from the ambulance and the gurney and put them in that way. The largest one is for a mother and baby or a child, because we've done 2,600 sessions on children with autism. And so that's, or father and child. And so you can actually sit up in that and you can have a young child with you too.
Can you talk about, some people put you in a pressurized chamber, but the oxygen is coming through a mask, a full face mask as 100% oxygen versus being in the chamber that has 100% oxygen. Do you thoughts on that?
You are getting more oxygen when you're in a monoplace chamber because your whole body is being exposed to the oxygen. And your skin is absorbing it. Can I tell you statistically how much? No. I mean, all the, the studies have also been done on people getting multi-place chamber treatment. So it's still therapeutic. They're reaching therapeutic levels. But multi-place chamber can be cheaper, less expensive because they're, putting a bunch of you in the room.
Yeah.
So.
And I know some of the machines will do just what I said. They're single, but they're pressurized, and they don't pressurize the whole thing with oxygen.
Right.
They have a mask that does it. And those machines are a little cheaper, and the oxygen requirements are less for the facility.
Right.
And that's why I'm just curious about the difference.
Yeah. And I know you asked the question about soft chambers before. Soft chambers are FDA approved for altitude sickness. They can help with inflammation of the brain, as in autism, cerebral palsy. Definitely helpful. And they can make if someone had mold in their system, it can make it worse. So you have to be careful. If you had a certain infection, it can actually make it worse. So, but in terms of doubling the stem cells and growing a brand new blood vessel and growing new tissue, you can't with a soft chamber.
Has that been looked at, or has it only been looked at the higher chambers?
You have to have, to grow a brand new blood vessel, you have to have a pressure of 2.4 atmospheres of pressure. That's what the studies show. And for mitochondrial resuscitation, they recommend 2.0 atmospheres of pressure. So you have to be careful because sometimes the soft chamber companies will take research that was done by hyperbaric oxygen under different pressure, but they just use that research, but they don't reveal that the pressures are different than what they're using.
Yeah.
So you just want to, make sure you're lucky. And there's more and more research coming out on soft chambers. That's not a world, because we deal with hospital grade. It's not a world that I'm so entrenched in, so.
Any other questions? Yeah.
A soft chamber, I believe, and it was a home unit. I helped her put it together and everything. Are there contraindications for that for a person that has multiple system failures? Or how do they compare to what you have in your space?
Yeah. So, with a soft chamber at home, you can't use oxygen. So they're pulling from the room air and then they're compressing it. So you can't reach 100% oxygenation. You may reach 88% or maybe 90%. There's been no studies on 88% oxygen. Theoretically, having more oxygen could improve things, but it's not going to get you the results that hyperbaric really promises. So sometimes hyperbaric has gotten a bad reputation because people say, well, I got a chamber and I used it at home and it didn't help me. Well, wasn't really the right thing.
Yeah. Some of them will do, I don't know if your friends has this, but it has the mask that's providing 100%. They didn't. Yeah. So there's sort of a little bit of both. So you end up, it's sort of soft on both sides. But, the cost is different. These are over $100,000, $200,000 machines versus 25 or something. Any other questions? I have a few, if not, Harris. So maybe talk about facilities in the Bay Area. There's the one in Larkspur. Where are some other ones if people want to access them?
Well, we're in San Rafael. We were in Larkspur. We moved right before the pandemic. So we're actually on Irwin Street in San Rafael, very close to the freeway there. There is also one in the East Bay. And there's...
In Oakland, I think it is.
Yeah. To be honest, I haven't seen it yet, so I can't really...
I hear it's a good facility.
Yeah, so, yeah. And there's also one in the South Bay area, like Los Gatos area,
I think that's
right?
Los Gatos, yeah.
And then St. Francis closed, I believe. St. Francis Hospital, that facility closed. So
Great. And one final question, yeah.
I do have a question. Have you ever done anything with pets? Has anybody asked to have their pets done?
they have hyperbaric oxygen for racehorses, and we love animals. And we all wanted to have one for vets. We just thought, it'd be incredible to have one for cats and dogs. They love it. And animals are amazing at healing. But, we didn't have enough rooms. When the pandemic hit, we had to have people separated. And, but yeah, if we had a grant or something like that, we could extend our building. We would love to do that because we bring dogs to work, and if we put them downstairs, we have a dog area, but all of us love animals. So
Yeah. For chronic and healing wounds.
Yeah, it would be incredible. And really incredible.
The racehorses?
I don't know, but they have hyperbaric oxygen chambers for horses.
Yeah.
Yeah.
Well, thank you for coming. It's really a special moment to have you here, and it's great to talk about all this with you. We'll post this up on the YouTube channel for those that
Sure. Thank you.
that haven't had a chance to watch it. They can watch it in the future. We do this every month.
Yeah.
So come back for next month, and we look forward to seeing you then. Thanks so much.
Thank you. Thank you so much. Yes. Thank you. Thank you, Brad.